Hello, my name is Robert Bonow. I'm a professor of cardiology at Northwestern University in Chicago. And I'm here representing the American College of Cardiology at the Colombian Society of Cardiology meeting in Cartagena, 2015. I'm delighted to have participated in an important session jointly between the American College of Cardiology and the Colombian Society on valvular heart disease. And the first topic we discussed was aortic stenosis, a very common problem with an aging population. Not to mention the fact that 1.5% to 2% of patients are born with bicuspid valves. And so between the congenital abnormalities we see in a large number of individuals who come to us with aortic stenosis with bicuspid valves, and an aging population who develops degenerative calcific aortic stenosis as a function of aging, we are seeing in both Colombia and the United States a large growing number of individuals who present with aortic stenosis. Over the age of 75, roughly 6% of the population has significant aortic valve disease. We now have emerging, exciting new therapies for treating patients with aortic stenosis. Very good surgical centers can deliver low-risk surgical aortic valve replacements. And in our higher-risk patients, we now have transcatheter aortic valve replacement opportunities. We are struggling with identifying all of the appropriate patients for these new therapies, but this really has been transformative in allowing us to treat patients who previously were untreatable with aortic stenosis. So identifying those patients now is also a challenge. We have newer imaging techniques to identify patients who have significant aortic stenosis using echocardiography, CT scans to look at the amount of calcification of the valve. MRI also allows us to assess function and flow, and in patients with bicuspid valves, whether there's also enlargement of the aorta, which can be a concomitant comorbidity of patients who have bicuspid valves. So between the advances in imaging, advances in surgery, and advances in interventional cardiology, we have enormous new power to diagnose and treat patients with aortic stenosis to provide better outcomes. This is accomplished by achieving a heart team to bring people together, to work together to provide the best decision-making, involving cardiologists who are both interventional cardiologists and non-invasive cardiologists, and surgeons and nurses to provide the expertise, the center of excellence to provide the best quality of care. I think we are seeing this in Colombia. We're certainly seeing it in the United States and elsewhere in the world because of the power of our new diagnostic technologies, as well as our new interventional opportunities for our patients. And it was very exciting to have that discussion with my Colombian colleagues during our joint session yesterday to see the progress that we're making in both of our countries. Thank you very much.